We go now to our reporter Laura Windsor with more on hearing loss.
Hearing loss can affect you in many different ways, such as feeling anxious, upset, and left out. But how common is hearing loss? We spoke with Dr. Maya Kato at Desert Regional Medical Center in Palm Springs, California, who gives us more.
Hearing loss is one of the most common chronic health conditions affecting Americans. And half of the patients over the age of 65 have some degree of hearing loss. And an even greater percentage of adults over the age of 75 have hearing loss. Just as many of the other organs in our bodies age, our eyes age, we need to wear reading glasses as we get older, our ears age too. And although for the senior population, many of them feel that they may just have age-related hearing loss, it is important that if someone feels that they have a hearing problem, that they see a physician. Hearing loss can have many causes. It can be due to an inner ear disorder, it can be due to infection, and it can even be due to something such as a brain tumor. So for these reasons, it's very important that someone see a physician, a medical doctor, not just a hearing aid dispenser, in order when they feel that they have hearing loss.
Exposure to noise is a definite risk factor for hearing loss.
If someone is exposing themselves to a lot of loud noise, you get acoustic trauma to the inner ear, which also kills off the hair cells that are responsible for hearing. So occupational noise exposure is certainly one problem. Another problem, though, can be the younger folks who are listening to their iPods or their music way too loudly with the earbuds very close to the inner ear. So we recommend that the noise levels or the sound levels for people who are enjoying music be at a reasonable level.
Dr. Kato tells us about the treatments for hearing loss.
For the most part, we've been talking about age-related or noise-induced hearing loss, for which most of the times hearing aids are a good solution. For somebody who has an age-related or noise-induced hearing loss that has become so severe or so profound that they are failing to benefit from their hearing aids, then cochlear implantation is a type of surgery that actually brings hearing back to someone who has become profoundly deaf over time. We can also do cochlear implant surgery for children who are born deaf, which allows them to grow up and participate in a hearing world. Certain types of hearing loss are called sudden hearing losses that are due to a viral illness of the inner ear. Those patients can become profoundly deaf in one ear typically, and if we see them in the medical office soon enough, we can help to recover that hearing by treatment with steroids. Other patients may have a problem with the hearing bones due to dislocation or stiffening of the bones over time, and these patients are treated with replacement hearing bones that are put in with surgery. Other patients may have other problems, such as a hole of the eardrum. Perforations of the drum can occur from infections or from scuba diving incidents or from trauma. And so for those patients, surgery to repair the drum helps to correct their hearing loss.
Dr. Kato related how rewarding it is to help someone hear again.
Some people fail to realize is that our hearing is the way that we communicate with our friends and our loved one and the world around us. And I think it was in fact Helen Keller who had said of the two disabilities, being deaf and blind, her blindness separated her from objects, but her hearing loss was what separated her from people. So to bring somebody back to hearing and communicating with the world around them is extremely gratifying.
If you feel you have a hearing problem, talking with your physician as soon as you notice difficulty hearing is the best way to handle the problem. For the American Health Journal, I'm Laura Windsor.